She was given an epidural, but the anesthesiologist inserted the catheter incorrectly. He also failed to wait long enough between the test dose and the full anesthetic. Then he gave her more medication, but didn't document it. Sha-Asia went into cardiac arrest. Doctors performed an emergency C-section. Her daughter Chloe survived, but after 45 minutes of CPR, Sha-Asia was pronounced dead. And an investigation later revealed multiple medical errors. The anesthesiologist lied about the procedure and kept poor notes. He eventually lost his license, but no criminal charges were filed. No hospital system reforms were publicly announced. No one else was held accountable. Sha-Asia's death sparked protests and a renewed call for transparency in maternal care. A mural was painted in her honor, a memorial garden was planted, but her family is still grieving a loss that should have never happened. Black women in the U.S. are nearly 3 times more likely to die from pregnancy-related causes than white women, even when education, income, and access are the same. Sha-Asia Washington was one of them, and the timing of her death, the day before America celebrated freedom, is a painful reminder. We cannot celebrate liberty while ignoring inequality. We can't claim justice while mothers are dying preventable deaths. Every voice, every story brings us closer to a future where Black mothers are seen, heard, and protected, not remembered only after tragedy. Healing starts with knowing. Follow for more.
Wow. It's worse, worse, and it's getting worse, you guys. Not only did this happen in Indiana, but there was also a case this same past week as well out of Dallas, Texas, where something similar happened to a young lady. She went to the emergency room. Many of you probably saw it on social media. She is crying out in pain. And the lady that's doing the intake, I'm assuming it may be a nurse, is just casually sitting there, name, date of birth, due date, and as her mother is sitting there watching her child in labor suffering, she asked the question, do you treat everybody like this? Or is it just the Black patients that come in for care? Do you treat everybody like this? So, I'm thinking, I'm listening to this, and I'm just wondering, what can we do? Again, I asked that question earlier, Miss Black Hollywood, and I want to revisit that. Is there anything that we can do? Let's go back to Mercedes and her family. Was it something they could have done differently to get a different result? What can we do? Miss Black Hollywood, I throw it to you.
Yeah. What I noticed is that she went to the hospital and she didn't have a doctor. She didn't have an OBGYN. That's something I noticed when I went to get my doctor. I was looking for a Black doctor. That was just, and I didn't find one here in Los Angeles that was in the network and all of that. There just wasn't. But I found a person of color. And so every time, just somebody going on that journey with me. And when my blood pressure was high, when implantancia came and I was having all of these internal issues, there was somebody there to hold my hand. He was at when I got there the morning of, he was there. I mean, just always there. I was going, there was somewhere I had to go, and he walked me through the entire 9 months. And so I would just say that was my biggest concern. That wasn't her doctor, but had she had a relationship with a doctor, I just don't believe that she wouldn't have seen a doctor, and the nurse would have been her only opinion, because she was asking, as a matter of fact. Go ahead.
No, I want to say, let me interject there, because that was my experience as well. When I went into labor, my doctor was not on duty. So the person that I had been seeing was not the person that delivered my child. So I can see times when that may happen. The person that has been your primary care provider may not be there at the time when you go into labor. Think about it. It's Thanksgiving holidays. Your provider could be off. Your baby doesn't know that it's Thanksgiving when they're ready to come.
We need a plan B. We need a plan B. Is there somebody else in the office? Is there somebody else in that, just depending, right? They were on their way to another community hospital. So that just tells me that maybe they did not have. And this is not, this is no judgment, because then we get into the whole conversation about money and healthcare and the expenses of that and how expensive it is. So there's a lot of I'm just thinking out loud, like maybe there are again, outside of just really having to advocate for yourself and understanding, are there doctors of color that can walk you through, that can create like a medical plan?